As noted, I used to be the Director of Certification, and I started that job in 2003. And one of the first things that happened at that time was we had our largest number of immigrants coming to Canada to work in our profession, medical laboratory science. And we didn't have a really good handle on it. So one of the things we thought we should probably do then is do a little bit of research and find out what are the best practices in prior learning assessment. And the challenge sometimes when you're a little bit ahead of the curve is that there were not a lot of best practices or a lot of promising practices and innovative practices. And we partnered with, as you might expect, one of the experts in prior learning assessment. We partnered with Canadian Association for Prior Learning Assessment, CAPLA, and they helped us really sort of review our process, and even before the Fairness Commissioner's Office came along, to make sure that we were building a system that was based on the principles of transparency, fairness, impartiality, and openness as well, making sure that we had information that was available. And one of the first things that we discovered is several people are not doing too well on the national exam when they're internationally trained. And I have to say, after a decade of work, they're still not doing really well on the exam for a host of reasons, not the least of which, the very first piece of research we uncovered while I was working on my thesis was we discovered that people who have access to a bridging program fare very well on the national certification exam. A decade later, my problem is I don't have enough bridging programs in Canada. There's one great bridging program out of Mohawk College in Hamilton. It takes 11 students a year. I have a need for 200. So given that I have essentially 190 people that have to find their own way, we find it really important to partner with people like the Fairness Commissioner, with Wayne's agency, with CIIP to make sure that we have a lot of information out there. So my advice to anyone who's helping a newcomer is if they have any ability or means to enroll in a bridging program, to help them with the critical components of integrating into Canada. And it's not just the technical. Everybody thinks, what are the technical skills I need to be a nurse in Canada? And that is a fraction of what is necessary. What's necessary is exceptionally high language proficiency skills. We spent a long time doing some research, trying to figure out how high is too high for a language proficiency standard. And are we just being mean? Because what happened was our standard was about here, and through time, I partner with my regulators from across Canada too. We're unique in that we have a one-stop shop for Canadians and internationally trained for the entire country with the exception of Quebec. So every single medical lab technologist passes through the Canadian Society. So that's great because we have a great information portal. There is one place to go for information in the profession in Canada. It's also one of the hardest things because there's only one place to go for an opinion. So we make sure we have appeal mechanisms in place. If you forgot to get documents from back home, you can submit them in after the fact. And that's part of our commitment to making sure that we're being fair to people because they might not understand how important some of the documents are. But the bridging programs are so rare that anyone who has an opportunity to take it, they're definitely expensive, they're not easy to get into, but they certainly shorten the time frame anybody needs. So while we were working on our language fluency standard, all the bridging programs started the same. They just jammed technical information in it, which was helpful. But what they realized was people need the day-to-day conversation. They need to improve their language skills. And the hardest thing that I have experienced in 10 years working with the clientele is the regulators acknowledge the need for high level of language fluency, the employers acknowledge the need for high level of language fluency, the testing agencies acknowledge the high level of language fluency. The last group to acknowledge the need for high level language fluency is the immigrant. And so in my own field, we set a benchmark and we had complaints from regulators that said not high enough, not high enough. And employers weren't employing people, so we cranked it up. Not high enough, so we cranked it up again. And then I remember getting a call once from, I don't remember who it was, and we had somebody call us and they were absolutely livid because our level language of fluency required was the same as the U of T entry requirement for physicians. And someone called and said, how can lab technologists, people who handle blood, who just collect blood, right? We don't just collect blood, I assure you of that. But that was the perspective. How can people who just collect blood have to be at the same level of physicians? And I thought, who do you think gives the data to the physicians? They have nothing in their file if they don't have good data coming from the lab. So we were worried, though, about the lens of fairness because we just kept turning it up. And what we decided then to do was to do an evidence-based approach to establish a language proficiency standard. And what we found out was it takes people a long time to get their files ready. It takes them a long time to qualify for the national exam. So we validated that our language fluency standard was as high as it was necessary to practice to have a fair chance of passing the exam and a fair chance of accessing the profession. but it was too high for people just gathering documents and trying to get their materials together. So I think we're one of the few agencies that has a two-stage language fluency requirement. You need a Canadian Language Benchmark 6 to begin your process and to start your paperwork, and you need a benchmark of 8 to proceed to exam. And that was based on information that came to us from our language fluency expert who said, acquisition of language at the high end of the Canadian Language Benchmark system can take years to move from a 7 to an 8. It can take months to move from a 1 to a 2, 2 to a 3, but it's not like grades where you naturally progress 6 months, 10 months. So we have to acknowledge our own process might not have been fair because we were making people continuously take TOEFL or language fluency testing or taking language programs without actually having them able to practice in the field if it turned out their technical evaluations were not in line. So I have to say, in my own office, we actually do talk about what would the Fairness Commissioner say about this policy. And so we use the lens of fairness on a weekly basis in my organization when we talk to regulators to establish policies or procedures for prior learning assessment and for exam. And we do that because we believe everyone should have a chance, and a fair chance, but we don't want to compromise the national testing system by just letting anybody get to the exam. So we have to have a process of evaluation ahead of time. But we removed our Canadian requirement for work experience in 1999, acknowledging that it was not fair. And so several of my colleagues are now struggling to grapple with the fact that they must remove their language, their Canadian work experience time for part of licensure. The other thing that I would say is a lot of the associations are working, and associations and regulators are working on what to do with alternate careers now, and that's our next area of exploration. And alternate not as in a worse career or a default career or I didn't quite make it career. Alternate as in I can leverage my skill set for now while I'm working to build or to get towards the point where my portfolio is ready to move on to the national exam. Or somebody may choose that this new employment may be better paying, may be better for career advancement, and it may be a better lifestyle fit. So we're working on a research project now, and Wayne's on our steering committee as well to help us try to uncover the best way for us to do advising in alternate careers, being absolutely sensitive to the needs of the immigrant. When should I start to advise on that? Do I advise while they're offshore? In their home countries, or do I wait till they've missed a milestone along the way? And so one of the things we're doing now is pan-Canadian focus groups with our clients to find out when would you like to know that you might not make it, or you might want to seek a different kind of employment other than survival jobs. So all this to say, we've got a really large research agenda that's never going to be finished, which is great, and we need and rely on our partners in our process to help us find our clients. But our biggest gap right now is that we don't really have a lot of connections with the settlement agencies, and you'll understand why when I tell you 50% of my profession are from the Philippines, which is the least user group of social services in Canada. So I've got a problem. I've got you who have services, I have people who need services, and nobody has married them yet. So we try to advise people to seek support from immigrant serving agencies because there's a lot of answers there, but my people just aren't getting there. So at least they're going to one single place in Canada for information, but there's still lots of ways that we have to